Plantar fasciitis is the inflammation of plantar fascia, which is the ligament that acts as a connective tissue from the heel to the bottom front of your foot. So if you are having pain right here, that is plantar fasciitis. Or you could be having pain here as well, at the back of the heel. That's heel bursitis. Both are related to this main root cause I am going to discuss. If you did not get this injury because of sudden impact, like kicking or landing on your feet while barefoot on hard cement, chances are you got this because of having tight calves. I will be explaining why and the appropriate treatments for this coming right up. Before we start, please subscribe and hit the bell so you don't miss out any of our videos. Why would tight calves cause heel pain? Simply because your calf muscles are connected to your Achilles tendon, which is also connected to your plantar fascia. So if your calves are tight, everything down here will be tight. So having tight calves is the main root cause of why you are having plantar fasciitis. You are having tight calves possibly because you wear shoes with heels most of the time. So your calves got used to being always elevated or flexed, because naturally we are not supposed to be wearing shoes all the time and we walk flat on our foot. Another reason why your calves are tight is because you just sit down for long hours, and this will also cause your muscles to tighten up. Alright, so now that your muscles and tendons are tight, what did you do afterwards? You all of a sudden ran using golf or sprinter shoes where there is no heel, or you jogged uphill, or you simply walked barefoot on concrete. In these scenarios, your calves are suddenly extended, which they are not used to, and then you abruptly put stress on it. This in return will cause tear on the tissues inside your foot. The chances of getting an injury also increases as you age. That's just how it is. Remember, tight muscles, tight ligaments, and tendons easily break. Now we know the cause, what do we do? Treatment number 1, stretch your calves. You will need to make your calves more flexible. To start, hold on to a wall at arm's distance to keep your balance. Then put one side of your foot about a step behind your other foot while feet are flat on the floor. Bend the knee on your front leg moving forward, so your calf on the other leg will start to stretch. Count to 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Repeat this with the other leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Now put your feet together while your body and knees are straight. Hold on to the wall at arm's length, then move your shoulders closer to the wall as you bend down your arms to support your body like so. Once you feel the stretch on your calves, hold on to this position and count to 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. For these stretching exercises, you can do these once or twice per day. Treatment number 2, massage your foot. The science behind massage therapy as to how it can heal an injury much faster is because we add a bit of pressure on an area to signal and reactivate the cells responsible for repairing damaged tissues. Massages also alleviate stress and provide instant relief. To begin, sit down, relax, Then place the ankle of the foot that is in pain on top of the other leg's knee like so. Then use the hand on the opposite side and place your thumb at the back of the heel and the side of your pointer finger below the foot right before the heel bone. Now massage the back of the heel using the thumb in a circular fashion and count up to 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Next is to use the middle finger knuckle, which is this one, to apply pressure on the bottom of plantar fascia, where the inflammation commonly occurs in plantar fasciitis. Perform a circular motion and be mindful of the amount of pressure you are applying, making sure to not hurt or injure yourself even further. You yourself should know the right amount. Once you are okay with this pressure, count to 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. And then use the thumb to press and slide starting from the same area up to the bottom of the sole. This way it straightens up the ligaments back. Do this as well for 15 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. This massage can be done for a maximum of once every 2 to 3 days, or just twice a week. Reason is because we want a full rest in between where you actually recover from the injury. Treatment number 3, protein. Yes, not supplements, not protein shakes, but real protein from meat, like beef, chicken, eggs. You already know what they are. Protein helps in muscle and tissue repair. Consume protein in every meal every day. Treatment number 4. This is after a month of following the first 3 treatments we just discussed. By now your plantar fasciitis symptoms have subsided, or at least the pain has been greatly reduced. But plantar fasciitis has a tendency to be chronic, meaning it will come back again and again if you don't consider this 4th treatment, which is exercising your foot. How? Gradually start by just walking barefoot for at least 10 minutes every day, preferably on soft soil or sand. This will reintroduce how your foot and calf muscles need to properly react when you walk, and not always on shoes with heels. While walking barefoot, do a few, say 20 times on each foot, where you somehow exaggerate planting your foot with your heel first while keeping your toes up, and then slowly connecting the base of your foot on the floor, and then ending where your heel is up and the sole left planted. This concludes the plantar fasciitis treatments, and more exercises are soon to follow, so keep yourself updated on our channel. Your body has the capacity to heal itself, just remember to rest, have a balanced diet, and get some sunshine for that vitamin D. If you haven't done it yet, please hit like, subscribe, and click the bell button for more exercises and tips for a better pain-free body, better you.